Hi, my name is Sam Cobb. I'm the CEO of AdAlta Limited. We're an Australian listed biotech company. Our focus is developing our lead candidate AD214 for the treatment of fibrosis. So fibrosis is essentially scarring. So you get inflammation and a buildup of a protein called collagen. So our drug AD214 stops both of these processes. AD214, we recently announced that we had made a change from AD114 to AD214. It's an improved version that we've got for the treatment of idiopathic pulmonary fibrosis, so fibrosis of the lungs. There's a significant unmet medical need for the treatment of idiopathic pulmonary fibrosis. So there's currently 2 available drugs for that treatment. They don't work for everybody, and there's a huge unmet medical need for new drugs. So our drug AD214 can potentially be used for that indication. As well as a huge unmet medical need, there's a lot of commercial potential as well. So pharma deals happen at a very, very early stage at the end of phase 1. Our drug will be at that stage, AD214, in the first half of 2020. So we'll be looking to partner or take that through to a phase 2 study. In terms of partnering at that stage, we see deals of around 100 million up front and between 400 and 500 million in milestone payments. So a significant commercial opportunity in about 18 months to 2 years for us. Yeah, so as I mentioned, we've just moved to a new molecule called AD214. Last week we kicked off our manufacturing agreement for this product, AD214. We've partnered with 2 groups, Selexis and KBI, both internationally recognised manufacturers. That was really exciting for us because it meant that we are essentially kick-starting the milestones for AD214. So the next 12 months we'll be manufacturing. We'll be announcing within 3 to 4 months how that manufacturing is going. We'll also have additional non-human primate studies looking at the half-life of AD214, maximum tolerated dose, so initial toxicology studies. That will be moving towards our 4-week toxicology study in the second half of 2019, so in about 12 months' time. Once we've completed that 4-week toxicology study, we'll be moving to our phase 1 at the beginning of 2020 and finishing that in roughly the first half of that year. Team includes our board, led by Paul McLennan, who's our chairman. He's got significant experience in managing ASX companies, been a CEO himself. We've also got John Chiplin. He was the CEO of an antibody-based company called Arana, which was acquired by Cephalon. We've also got Robert Peach. He was the Chief Scientific Officer of Receptos, which was acquired by Celgene for about $7.8 billion. And we've also got 2 of our directors from UWA Capital, James Williams and Liddy McCall. We're also surrounded by an internationally recognised scientific advisory board, including Brian Richardson, who was the head of R&D at Novartis, John Westwick, who was the head of pulmonary drug discovery at Novartis. We've also got 2 ex-Pfizer scientific advisors who are both clinicians, David McGibney and Steve Felsted. So we're surrounded by world-class international drug developers. Our team more recently also includes Dallas Hartman. He comes with significant manufacturing experience, and our Chief Scientific Officer, Mick Foley, who has amazing experience in terms of drug development and drug discovery. Yeah, our key message would be that we're taking AD214 to a major inflection point, taking it through to the end of phase 1. There's a huge unmet medical need and significant commercial opportunity. We've got a platform, a drug discovery platform sitting behind that called the iBody. There's a great opportunity for this, including partnerships and also further pipeline development. And in the near future, we're looking to raise funding to take 8214 through to the end of phase 1. I found the conference to be great. I've met a lot of new investors, which is always great. It's my first time in Hong Kong, and I've really enjoyed meeting a lot of great new people.